thank you everybody for the opportunity for me to speak in this event. Please, may I introduce myself and my organization. My name is Bagus Utomo. I'm coming from the Indonesian Community Care for Schizophrenia. It's in Indonesia, it's a Komunitas Peduli Schizophrenia Indonesia. It's KPSI. It's a consumer group. It's coming from my personal experience as a caregiver of my brother. It's already about 18 years until now, and now he already recovered and coping well with his condition. KPSI start in 2001 as a virtual mailing list in Yahoo groups, initiated by me. And in 2009 we moved it into Facebook. Coming from the virtual community, we also want to bridge it into real world. So we make a first gathering. This is our first gathering. Only several people coming, but from 2009 until now, the group is growing so fast. Currently, it's almost 8,500 per August 2013. The discussion is in these online communities very productive. I think everybody enjoy the warm welcome of the old member, so they come a very big family, so they can provide support to each other and then visit each other. So this dynamic interaction makes them wants to create a local group. Until now, there is already a local group in 10 cities: Jakarta, Yogyakarta, Malang, Bandung, Surabaya, Solo, Medan, Jember, Padang, and Bogor. So it is quite interesting how they support each other in their local areas. Yeah, even without any support from psychiatrists in their area, but this online resource makes them quite confident to support each other. And the good thing is, this 2013 we have already 2 office secretariats, and it also become the clubhouse to our communities. So all the members can come and go anytime they want. They can get information from other families. They can have guidebooks, everything they need for supporting their family members. It is a very good opportunity created by the. In 2012, I got a Queensland Award. So we have about $50,000 prize money. We use it to create programs to the consumer group. Speaking about our focus, we focus as a consumer group. So most of the members must be families or the people with mental illness. But we also welcome other community members who really care about these issues. We also focus on psychosocial rehabilitation. We know very well that after hospitalization, sometimes we don't have any activities for the people with mental illness. It's a very typical problems with families. So we want to have this kind of clubhouse in every province in Indonesia, so families can connect each other and then they can empower each other. We also support the evidence-based approach and appreciate cultural aspect as well, because Indonesia consists of so many ethnic groups. They also have religious belief and spiritual belief. It is sometimes very difficult to explain about modern mental health knowledge to them. So we kind of make a flow chart for the consumer. For example, some people believe that this is caused by supernatural beings like jinn or something. So we give them a room so that they can visit religious or supernatural readers, so they can make sure that this is already taken care of by the expert. And then just after that, we educate them not to take so much time for that effort. You have to go to the psychologist or psychiatrist as well as soon as possible, especially if there are relapse. So we recommend them to visit the expert. And then promotion and education is one of the most important aspect, because coming from my experience, I already dealing with the mental illness with my brother. It takes about 10 years before I got a proper information about mental illness. Even my brother, he was a dentist working in studying in the Salemba University of Indonesia, but he didn't get the proper information about the mental illness. So we promote and educate as much as possible, and we want to empower all the family members as an agent of the promotion as education. We also have our target is going to have a clubhouse in every province. It's a kind of a dream for me and all the members. And we also want to have a research, because we need findings in the side of the consumer. Our program is we want to have a member database, because currently we only have a virtual members database. We say that we have about 8,500 people, but in reality we don't have any exact number of members. So this year we already developed a database. We try to make a member card just to encourage people to join, and then we want in 2 or 3 years ahead, we want to show the government or House of Representatives that we have real members. So we need them to give attention to our movement. And then we also provide telephone hotline in all the telecom providers. We create peer support group. It's a self-help groups for the people with mental illness, and then also for the families. We want these self-help groups in each area, local group. We also have an art and creativity class, psychological counseling. We have already one psychologist, clinical psychologist volunteering for us, so we provide psychological counseling this year. Some of the public already use the service. And then we also want to have outreach, but we already try to create this system, but unfortunately because of the funding reason, we need to evaluate for the future. Then we also have entrepreneurship training. One of the most important thing is legal and human rights advocacy, because we as a consumer don't know what is our rights. and then what is violating our rights from the public here, because we know that sometimes we receive violence response from the public, so we want to advocate about this. And then we also provide workshop and training, and this year we already have a website. We also develop newsletter. We already distribute to the members, or the registered members, and then we already also put the PDF version of the newsletter. It names Jalin Jiwa. It's a kind of a soul network between people. So we also have a film screening every month in 2 office secretariat, and then we also develop a mental health library. It's a focusing on the guidebooks for the consumer in Indonesia, ya, in bahasa Indonesia especially. And then we also publish book. We already published 2 books. The Gelombang Lautan Jiwa is a kind of biography from the people with mental illness, and then the a collection of stories from families. We want to have a documentary film, but not yet. And then art gallery and charity shop, it will be there in the future, because we want this the works of the people with mental illness can be shown to the public, and then so they can appreciate what they have done. But we already set up also a gallery in our website, so people already can visit. Yeah. We also have great interest to develop a case management system, because currently now every month we receive about 30 phone calls coming, and then about 30 new consumer coming to our office secretariat. So we need some kind of database and to manage this data, and then we want all the client to get access to the programs we have. So in the future we want to develop a kind of a customer relationship management application. It's a case management system, so we can have a good grip about the progress of each client, so we can have a good monitoring and evaluation report to the families as well as to the funding agency who support us. This is our website. You can check it in the www.peduli-schizophrenia.org. This is I want to explain our target as well. This is not a short-term target, but quite a long-term, because we have a problem with the human resource as well and the funding. Yeah, but we already set up a kind of a base study to create a legal advocacy division for KPSI. The current problem is we have voters' right, but currently the people with mental illness sometimes doesn't have that rights. So we want to get this voters' right as soon as possible, because if we get this voter rights, then we can change the condition in Indonesia. And then violence issues. This is a kind of a stigma in the public. We have to reduce that. And then also the jobs problem. Most of the people with mental illness losing access to the jobs, and then access to mental health services, as Ibu Dia and Mbak Vita explained. Sometimes access is not only for about the availability of the institution, but also the geographical access, etc. Yeah, this is still a problem. And education, we have some cases that people with mental illness losing their rights to continue education. So this is very important. And health and social security support, we understand that people with mental illness become a burden to the family. So this is very important. So people with mental illness must have social security, so it not become a long-term burden for the family. They also lose access to microcredits and human rights issues, and then also housing, proper housing. Because if you have housing, yeah, and then you have a dignity, kind of a room for yourself. Yeah. All the issues become a discrimination and negative stereotyping to the people with mental illness. It is very obvious for us about this stigma. Yeah. What we will do is we will advocate supply target to the policymaker, and then we also have a demand target to our internal organization. To the supply, we want to advocate policy and budget, and then for the demand side, we want to advocate legal and human rights empowerment. The issues in strengthening the supply side is we want to advocate policy without discrimination, budget without discrimination, improving awareness for policymakers about mental health consumer organization, and then we want to have a strategic management to improving public services to people with mental illness. In the demand side, we want to improve human rights awareness to all the consumers, and then we want to accept public complaint and manage that public complaints into a proper database, so we can generate data and then present it into the policymaker. We also want to strengthening communication and media for human rights awareness. This is the opportunities in Indonesia in the side of the consumer empowerment. Yeah, we have growing so fast. About 100 people joining in the Facebook every week. So we know that there is a Facebook group with about 25,000 members. So there is a lot of rooms to grow. And then speaking about the viral movement in social media, if today people joining 100, maybe 100 people a week, so it will be exponentially growing. So we have to take this opportunity for the future. And then by having the consumer group, we also have the capability to grab the success stories from the grassroots. Yeah, some people sometimes feel afraid to open up because there is no one who back up if there is some trouble. Yeah, so by having this KPSI, we want to make sure if you speak out about your experience, we will back you up very well. So in the future, we want to have to expose more success stories, so it will bring hopes to the people. And then we will have a multiplying effect because, as I already presented, it grows from the grassroots. The needs to have local groups. I think this is very important if you want to provide information to the people related to the, for example, the Pasung, free Pasung movement. If you have this kind of local group, everybody can come and get the proper information anytime. Yeah. And we also have opportunity to network to other NGOs. We know there are lots of private rehabilitation centers, which is private rehabilitation center. We want to network with them, and then it becomes a bigger network. We also have it means we have more long-term support for patient in community level. We also have a pressure we become a pressure group to government and House of Representatives, and then the most important thing is we want to promote and bring kindness and compassion as a powerful resource to fight stigma in Indonesia. So this is my presentation. I hope this is you can.